The positioning sling is used to transfer from bed or floor to boost or reposition in bed and to turn patients from a supine position. Positioning slings come in several different fabrics, including knit, mesh, single client disposable, and spacer skincare fabric. The same sling application and transfer procedure is used whether lifting from bed or floor and with all fabric types when using a positioning sling. As with all medical devices, use sound clinical judgment and always use lifting devices for only their intended purpose. This positioning sling is made of spacer skincare fabric. Features of this sling include the body of the sling with the smooth side opposite the label for placing towards the patient's body, a stitch indicating the center line of the sling, and connection loops for attaching the sling to a carry bar. Within the connection loops are destination loops, used for positioning the client and adjusting the amount of recline. The sling label lists the type or style of sling, the size, the reference or product identification number, and the maximum allowable weight or safe working load. Remember to always stay within the lowest safe working load of any component in your lift system. The label also includes washing instructions, which are detailed later in this video. Packaged with each sling is a user instruction sheet. This positioning sling is in single client disposable fabric. The label indicates "Do not wash." Single client fabrics may be cleaned of light soiling and are meant to be reused by the same patient until the sling shows any sign of damage or wear or becomes heavily soiled, at which time it should be discarded and replaced. Positioning slings are sized according to the dimensions of the body of the sling rather than the patient's height and weight. The maximum allowable weight or safe working load of a positioning sling is determined by the type of fabric the sling is made of. Check the label for the safe working load of the positioning sling you are using. Visually inspect every sling before use. Discard and replace the sling if any signs of damage or wear and tear are found. To place a positioning sling under a client in a supine position, fold the sling in half with the label on the outside using the center stitch as your guide. Next, roll the patient to their side. Adjust sling position so that the fold is about hand width from the back of the patient. Roll the top fabric of the sling over on itself, tucking the loops in the fabric, and roll the fabric to the patient. Tuck the roll of fabric under the patient. And roll the patient onto their side. Unfold the sling. Then, roll the patient onto their back and onto the center of the sling. Bring the carry bar into position lengthwise along the patient, keeping a hand on the carry bar whenever it's in the transfer area to prevent it from bumping into something or someone. Attach lower sling loops to lower carry bar hooks. And the upper loops to the upper carry bar hooks. Whenever attaching loops to a carry bar, make sure to match the hooks and destination loops on the left and right sides so the patient is raised as straight and level as possible. Raise the patient just enough to put slight tension on all loops. Make sure they're well secured on the carry bar hooks, that the sling is well positioned under the client, and that the client feels safe and comfortable. Sometimes adjustments are needed. In this example, we see that the destination loops are all the same length, and the patient has been raised in an uncomfortable head-down position. So, we'll lower him and adjust the destination loops to raise him in a more level position. All positioning slings have multiple destination loops. You can adjust the amount of recline by connecting different destination loops to the carry bar. People differ in size, shape, and center of gravity. Attach the sling loops to the carry bar in a way that best suits the client's condition, positioning needs, safety, and destination. Here, we'll attach shorter loops near the head so we can lift the patient in a more level position. Bring the carry bar into position lengthwise along the patient. Attach all the sling loops using the longest loop setting from the side of the sling, which is opposite of the direction in which the patient will be turned. The 3 straps nearest the patient's lower body will be attached to the lower carry bar hook. The 3 straps nearest the patient's upper body will be attached to the upper carry bar hook. Once secure, ask the patient if they feel safe and comfortable. Now, using the up arrow on the hand control, raise the carry bar and the patient will begin to turn. Once securely positioned in the sling, lift the patient only as high as necessary to transfer them. Transfer the patient to their destination and safely lower them. Removing a sling is the reverse of placing a sling under a client. To remove the positioning sling, first remove the sling loops from the carry bar, starting from the head, working down to the feet. Log roll the patient to remove the sling, rolling the sling over on itself and tucking the loops inside the roll. Roll the patient to their other side and remove the sling. It is acceptable to leave the positioning sling under patients who do not have skin integrity concerns, and a best practice to put a positioning sling under a sheet as part of making up the bed before the patient arrives whenever its use is anticipated. For patients with skin integrity concerns, the positioning sling is available in a breathable, stretchable spacer fabric, which is compatible with airflow mattresses, distributes pressure more evenly than other fabrics, and helps prevent pressure sores and skin tears. Washable fabric slings should be placed in a mesh laundry bag before laundering to avoid tangling, wear, and damage by washing machines and agitators. Wash in a mild laundry detergent and never use any kind of chlorine bleach. Fabric and loops exposed to chlorine will show a color change and should be discarded. To disinfect, wash at 176 degrees Fahrenheit or 80 degrees Celsius. Tumble dry low or hang to air dry away from direct sunlight. Disposable single client slings must never be machine washed. Disposable fabrics may be wiped clean of light soiling, but should be discarded and replaced when heavily soiled. For more information, please call us at 866-891-6502 or visit our website, prismmedicalinc.com.